Good evening, study partners. Welcome to Wednesday Night Study Live, where we gather to study for addiction counselor exams and to master addiction counseling topics. If you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. By day, I'm a therapist and mental health educator. Over here on YouTube, I am your study partner. I make videos about mental health and substance use related topics. I also make exam prep videos to support you in mastering general exam topics like assessments, client education, screening, laws, ethics, all of the above to support you in passing your license and certification exams. If you are new here, yes, this is a good place to study for your ADC, your AADC, your NCAC1, your NCAC2, your MAC exam, national certifications. Maybe you're new in your counseling program. Maybe you're interested in becoming an addiction professional and you just want to learn more about it. Any of those, you are in the right place. Remember, we study general topics. So we master general topics because all of us are studying for different reasons, but we gather here together for accountability reasons. This is our little corner of the internet. So if you're asking yourself, I wonder if this is good for, it probably is. But remember, your main resource is always going to be your exam website. So make sure you're clear on your exam formatting, what domains and topics you need to study. But this will probably be a helpful resource for you. And we're happy to have you here. So welcome again. Come on in, come on in. Let's see what the chat is talking about. Good evening, Akila. Good evening, Anisha. Okay, so if this is your first time here on Wednesday Night Study Live, you have caught us on an intensive Wednesday. So tonight we'll be doing 3 straight hours of study topics related to ethics and professional responsibilities. But typically when we meet on Wednesdays, we meet at 7 o'clock for 1 hour. We complete 10 practice study questions on a particular topic. I read the question, pause. You put your answer in the chat. Then I reveal the correct answer and provide explanations for both the correct and incorrect answers. First of all, this is a way for us to all hold ourselves accountable because most of us are working clinicians, busy. You know, we have families, we have things to do. So this is our part of the internet where we can just meet up and hold ourselves accountable to study so we can pass our license and certification exams. Secondly, it primes you for testing and exam work. Many of us study for months and months, and then sometimes we let our anxiety get the best of us. Or if your exam is more than 6 months out, again, life be lifing, and we'll just put it on hold. We don't have anybody to hold us accountable. So this is a way we can show up, get some study time in, and go on about our business. It also helps us with clinical reasoning. So if you're consistently reading about scenarios related to drug counseling, chemical dependency, addiction, you are priming your mind and your thoughts to prepare for your exam. Sometimes we overstudy, so we're taking in a lot of information, but we never get a chance to practice and actually make sense of all of the information we have in our mind. So again, I'm happy to have you here. I'm happy to support you in passing. Ways to support this educational channel. First of all, if you are watching this, hello to the playback. If you couldn't be with us live, no worries. You still got to get your study time in. You already know how we do. Make sure you like this video. So if this is helpful, if you want to support this type of community, like the video, subscribe to the channel so you never miss a weekly video. But liking the video and commenting and interacting with the channel helps put us in the algorithm so we can find other study partners. We've recently reached 3,000 study partners nationally, worldwide. So we're finding each other. So there's a first way you can support. Also, if you are preparing for an exam or if you're interested in this topic, make sure you watch the full video to the end. Also, you can share this video with someone who may be studying or preparing for an addiction counselor exam. If you're on your phone, under this video, there's a hype button, and you're just telling the algorithm, you're telling other people, hey, this is a great video. This is a helpful video. This is a video that's good for someone who's interested in this topic. If you're in the live stream, if you want to support by getting a super chat or super thanks under the video. And I also have Buy Me a Coffee, PayPal, Cash App if you want to support in that way. Again, we are 3,000 study partners strong. We're over 3,000 now. So thank you so much for supporting the community. We are finding each other. We're all over. All types of addiction professionals. We have students. We have seasoned professionals who've been in the field 20, 30 years. We have nurses. We have social workers. We have peer support specialists. We have people that work in inpatient community. We have people that work in MAC clinics. We have people who are retired. We have clergy. We have high schoolers who are interested in becoming addiction professionals, and and everything in between. So I'm excited about that. Okay, I'm going to check the chat and then we're going to rock and roll. Tonight is all about professional standards and ethics. So all 3 hours will be related to some topic that falls under this umbrella. All right. Somebody passed. I see. Congratulations. Akila! Congratulations. All right. Akila says, hello, everyone. I passed my ICNRC alcohol and drug counseling exam on Monday. Congratulations. Congratulations. All right. Thank you so much for updating us, Akila. That is awesome. That is awesome. That is great to hear. Good evening, everyone. Come on in. Make sure you hit the like button if you're already in here. Thank you so much for joining us live. The first hour is going to be on professional standards. Hope everyone is doing well. Happy to have you here. And congratulations again, Akila. Akila passed her test, y'all. I don't, Akila. I feel the most comfortable with exam prep for addiction counselor topics because I was an addiction counselor before I was a licensed professional counselor. I'm not sure if you guys seen my original video. My original video was how I passed the NCAC 1. I passed the NCAC 1 in I think 2018. I'm getting old, y'all. I'm getting old. 16 or 18, but I was a certified substance abuse counselor first, and I worked as an addiction professional for a few years, and then I decided to go back to become a licensed professional counselor. I actually had to go get a whole new master's degree, and when I started to do new videos, I feel most comfortable and most knowledgeable with helping people with addiction counselor exam topics. I've been asked, and I'm sure I probably could help, just like people that I know, but I'm not sure if I'm ready to do full NCE or the National Counselor Exam prep. So I'm going to stick with addiction topics for now. No problem. Thank you. I appreciate you for supporting this community. I appreciate you all. So going into the fall, we're going to stick with addiction counselor topics, drug topics. And this also helps me stay on my P's and Q's too, you guys. Addiction is my specialty, specifically with adolescents, but this helps me stay on top of my skills too, and it reminds me of different things that I need to do and be aware of. So yeah. But there is a need for exam prep, really, for counseling exam prep. All right, let's get started, you guys. professional standards and ethical decision making. So, for those of you, if this is your first week, we have been doing intensive 3-hour study sessions on Wednesdays for the last 4 weeks. I wanted to plan something that will be intensive, long. That way it'll be great for playback, or if you couldn't make the live, you can go back and have something to study while you're walking, while you're cleaning, while you're, getting yourself together or during your study time. So this is our 4th one, and our most requested topic that you guys request is ethics. Well, second. First is pharmacology. Second most requested is professional standards and ethics. So tonight, it'll all fall under the ethics umbrella, but different topics. Excuse me, you guys. So hour 1 will focus on professional responsibilities and standards. We'll review professional codes of ethics, scope of practice, client rights, cultural competence, professional boundaries, counselor self-awareness, supervision, and continued professional development. Hour 2 will focus on ethical decision-making. We'll work through how to identify ethical issues. We'll review standards and policies, and we'll talk about how you consider your options and when to seek supervision. And then hour 3 will be more focused on legalities, like legal topics and laws that addiction counselors need to understand. So kind of similar all throughout, but each hour it will be like a different focus. So let's go over a few subtopics for tonight. So professionalism and professional standards are the expectations for how we should practice as addiction counselors. They help us define what's appropriate, what's competent, and what's ethical, and what it should look like. So basically, if you live in Alaska, I live in Virginia, someone else lives in California, someone else lives in Texas, no matter where you go, if you decide to get licensed or certified to work as an addiction professional, you should have no problem with the basic standards. You should be able to understand what are the accepted practices for addiction counselors or addiction professionals. So we have a standard we'll consider a profession. That's why we have a code of ethics. And no matter where you go, there's an understanding of how you should show up. So that's all what that is, the standards. Our responsibilities are the actions we take to meet these standards. So these are things that we are actually responsible for in our day-to-day work when we're working with clients, when we're providing interventions of what we need to do in order to meet those standards. Ethics, laws, and morals. I know sometimes people use these things interchangeably when they're making decisions, but when we're talking about our work that we do, these are different categories. Sometimes they do overlap, but they have different meanings. Ethics are our professional standards that guide our conduct. They guide how we act, how we respond to the work we do. And it helps us answer, what should I do as an addiction counselor? Laws are rules established by the government that we are legally required to follow. So the law, when you're talking about the law, you're asking the question, what am I legally required to do? And then with morals, these are our personal beliefs and values about what is right and what is wrong. So when you're talking about morals, you're asking the question, what do I personally believe? And again, you need to understand the distinction between the three, when they overlap, when you have to manage one over the other, and what does that look like when you decide to be a licensed and certified addiction professional? Because some things that are legal and ethical, you may morally think is right or wrong. However, you need to be able to distinguish between the three, but also make the most ethical decision to make sure you're giving your client what they need. The distinction is important for the exam because your personal morals should not determine how you provide professional services to a client. You have to recognize your own beliefs while still practicing according to professional ethical standards and laws. So sometimes when interns or people interested in the field. They talk about they may be interested in becoming a therapist. And the first thing I ask is, are you aware of the professional standards that we have to, abide by? Because sometimes that can be the difference between someone wanting to be a therapist and someone wanting to be maybe a peer counselor versus someone being a nurse versus someone being another type of addiction professional. We're all helpers. So everyone falls under that helper umbrella, but depending on how you want to show up and depending on what standards you are prepared to follow, that is the question we all have to ask ourselves when we are pursuing license and certifications in these type of jobs, because there are rules, there are boundaries we have to set, and some people are not comfortable with those boundaries. So we'll talk more about that in some of these questions. Professional responsibilities and ethics. For professional responsibilities and ethics, there are a few key areas you need to focus on when you're studying for your exams. You need to know the difference between the three. You also need to understand scope of practice and competence. You need to understand if you're qualified to do and recognize when something is out of your scope. You need to be familiar with clients' rights and confidentiality, and also how to maintain appropriate professional boundaries. Also, you need to understand cultural and personal biases that may influence the care you give people. And finally, you would need to understand supervision, consultation, and when to refer out. As we go through these topics, think about three things when we're answering these questions. What is the professional standard? What is your role as the addiction professional? And what is the best action that protects the client? All right. So when we're talking about professional responsibilities and ethics, the skills you need to be able to have down packed are, you need to be able to apply the ethical standards. So if you're being asked a question, you need to be able to understand what is the most effective or best answer. All four answers may be quote unquote right or seem right, but remember you have on your addiction counselor cap and you need to answer it. You need to answer it from a perspective of you're a professional addiction counselor. So what is the best answer? You need to be able to recognize limits. You also need to understand how to maintain boundaries as a professional counselor. Remember, as an addiction professional and professional counselor, we have different rules about boundaries that may be different than someone outside of the profession. You need to also understand when you need to seek supervision, when you need to talk to a colleague, get consultation on different decisions, how to make appropriate referrals when you are doing ethical decision making and you may be required to not work with the client anymore. And you also need to be able to have a plan and understand how to effectively respond to ethical concerns. So per our profession, how do you deal with these things that come up? All right, I'm going to check the chat, make sure everybody can hear me. All right, if you guys can still hear me clearly, there's no glitching, there's no lag, please put a 1 in the chat so I can move forward and get to the questions. Thank you, Letitia. Thank you, Doreen. I'll keep going. All right. Question 1. A counselor personally believes that living with a partner before marriage conflicts with their religious values. During a session, a client shares plans to move in with their partner and asks the counselor for help discussing the decision with their family. The counselor recognizes their personal reaction and continues helping the client explore the decision according to the client's own values. The counselor's response best demonstrates the ability to A, maintain professional boundaries when personal and client values differ. B, separate personal morals from professional ethical responsibilities. C, apply cultural competence when a client's lifestyle differs from the counselor's. Or D, Preserve client autonomy when personal beliefs create a potential conflict of interest. Which is the best counselor response? Or the counselor's, which demonstrates the counselor's, this choice demonstrates the counselor's ability to what? Which one is the best answer? The correct answer is B. This demonstrates your ability to separate personal morals from professional ethical responsibilities. B is correct because the central issue is the difference between personal morals and your professional ethics. The counselor has a personal belief, but that belief should not be imposed on the client. Professional conduct requires the counselor to manage their own personal values and beliefs so they do not interfere with client care. A is incorrect because boundaries involve maintaining appropriate professional relationships. However, the primary issue here is not boundaries, it's separating personal beliefs from your clinical responsibility. C is incorrect because cultural competence may involve differences in values and lifestyles, but in this scenario, this emphasizes the counselor's personal religious conviction and the ability to keep it from directly affecting the client or treatment. And D is incorrect because client autonomy is relevant because the client should be able to make their own decisions. However, the question asks what the counselor's behavior demonstrates. And this demonstrates the ability to separate personal morals from professional ethics. So a question like this is testing your knowledge of how you distinguish between ethics and morals. So having this skill helps you to prevent you from putting your own personal beliefs on clients. Question 2. A client receiving substance use counseling tells the counselor that binge eating has increased significantly and asks the counselor to provide treatment for the eating behavior. The counselor has extensive addiction counseling experience, but no specialized training or supervised experience treating eating disorders. What is the best response? A. Continue assessing the concern while consulting with the supervisor about whether the counselor can incorporate treatment into this existing plan. B. Provide supportive counseling for the eating behavior because it may be related to the client's substance use recovery. C. Explain the counselor's professional limitations and coordinate an appropriate referral while continuing services within the counselor's competence. Or D. Obtain additional educational resources on eating disorders before determining whether a referral is necessary. Which is the best response? Client has co-occurring issues, substance use and eating disorder issues. You are trained in addiction counseling with no specialized training in eating disorders. What is your best response? What is your most ethical and best response? Okay, I see some C's. The correct answer is C. C is correct because the counselor has already identified a need that falls outside of their competence. The appropriate response is to acknowledge the limitation, facilitate a referral, and continue providing the service that remains within your scope. A is incorrect because consultation is often appropriate and makes this a strong possibility. However, supervision does not automatically expand the counselor's competence to provide specialized eating disorder treatment. So just because you know you need supervision or you talk to your supervisor or someone with more clinical experience does not mean you've received the training, and that doesn't automatically make you competent. B is incorrect because the conditions may interact, but that does not give the counselor competence to provide specialized treatment outside of their training. And D is incorrect because professional education is valuable, but independently reviewing resources does not establish competence and should not delay an appropriate referral. A question like this is testing your knowledge of scope of practice, competence, ethical decision making, consultation, and referral. So, understanding when something is out of your scope and you may need to refer a client out. Question 3. What is the main difference between laws and professional ethics when a counselor violates them? A. Ethics violations may result in jail, while law violations usually result in loss of certification. B. Law violations can result in legal penalties, while ethics violations can result in professional consequences. C. Law violations are handled by professional organizations, while ethics violations are handled by the courts. Or D. Laws and ethics are enforced the same way, but the consequences may vary. Which one best describes the difference between laws and professional ethics? Okay. Okay, I see a few B's in the chat. The correct answer is B. Law violations can result in legal penalties, while ethics violations can result in professional consequences. B is correct because laws are enforced by the government and courts. Breaking a law may lead to legal consequences such as fines or criminal penalties, incarceration. Professional ethics are enforced through licensing boards, credentialing boards, or professional organizations and may result in disciplinary actions against a counselor's license or credential. A is incorrect because this is reversed. This reverses the consequences. Jail or criminal penalties are connected to violations of the law, not simply violations of professional code of conducts. C is incorrect because this also reverses who generally handles each type of violations. So courts enforce the laws while professional and regulatory bodies address professional conduct. And D is incorrect because laws and ethics are not enforced through the same system. A question like this is testing your knowledge of law and ethics, legal requirements as an addiction professional versus your professional ethical requirements. The skill you would need to be well versed in is recognizing who enforces each and the types of consequences that may follow. So most of us here, if you are applying or working towards a certification or a license, each of us have a board of counseling. It may be called something different in each state. So we have to not only follow legal requirements as a practicing professional, we have to follow our board of counseling or whatever it's called in your state per the certification that we are trying to test for. Question 4. An addiction counselor personally disagrees with harm reduction approaches, including syringe service programs and medication assisted treatment. A client asks about these options. What is the counselor's best response? A. Explain the counselor's concerns about harm reduction and encourage the client to consider abstinence-based treatment instead. B. Focus on treatment options that are more consistent with the counselor's clinical approach and refer the client if they request other services. C. Provide accurate, non-judgmental information about available evidence-based options and use supervision to address personal bias. Or D. provide information about harm reduction, but explain that the counselor cannot support treatment approaches that conflict with personal values. So, what is your best response as an addiction professional? You do not agree with medication management or syringe service programs, any harm reduction approaches, and you are asked about these options. What is your best, most ethical answer as an addiction professional? The correct answer is C. Provide accurate, non judgmental information about available evidence based options and use supervision to address personal bias. C is correct because you, as the counselor, should provide accurate information without allowing your personal beliefs to limit the client's options and choices. As addiction professionals, we should address personal bias through supervision, not through the client. A is incorrect because the counselor is allowing personal beliefs to influence the information and direction provided to the client. B is incorrect because referrals can be appropriate when a service is outside the counselor's scope or competence. In this situation, the primary issue is the counselor's personal disagreement, not a lack of competence. So there's a difference in saying, oh, I'm not, I just don't know a lot about medication assisted treatment. I can refer you to someone or I can connect you to my colleague who knows more about that versus saying, oh, no, you don't need medication. Like, why would you want to you can do it on your own. Don't take medication. I do not agree with medication. It just makes it worse. Those are just two different approaches. And the personal approach should be avoided. And D is incorrect because providing the information is appropriate, but the counselor is still allowing personal values to interfere with professional responsibilities. What a question like this is testing is your knowledge of your personal morals versus professional ethics, client choice, and your professional responsibility. A skill that you need as an addiction professional would be recognizing your personal bias, providing objective information, and appropriately, again, using supervision to work through any disagreements or incongruence with the work you're doing versus what your personal beliefs are. Question 5. A counselor's beliefs about what is personally right or wrong are mainly shaped by family, culture, life experiences, and personal values. These beliefs are best described as A. Professional ethics, B. Personal morals, C. Professional values, or D. Standards of practice. So, what you believe personally, that's been shaped by your life, family, culture, experiences, what are they called or what are they best described as? The correct answer is your personal morals. B is correct because these are our personal beliefs about what's right, what's wrong, what's fair. They're often influenced by our upbringing, our culture, our experiences, and our personal values. A is incorrect because professional ethics are standards that guide our behavior as addiction professionals. They are not based on what the individual counselor personally believes. C is incorrect because professional values are principles connected to the counselor's professional role. The question is specifically describing the counselor's personal beliefs about what is right and what is wrong. And D is incorrect because standards of practice describe the expectations for how we as addiction professionals should perform our work. They're established by the profession rather than the individual's upbringing or personal beliefs. A question like this is testing your knowledge of morals, ethics, and professional values and standards of practice. So you need to know the difference between all of these. and how they impact treatment. The skill related to a question like this is your ability to identify when a personal belief is in play and how to maintain your professional ethics. Some of your answers, you may have a scenario and two of the answers are based on someone's personal moral beliefs on what is right or wrong. And it may sound really good, but the correct answer is the answer that best leans towards client safety, client choice, and professional ethical practices. So if the client believes something if the client chooses something that you wholeheartedly believe is wrong, but the client's safety is not at risk, the client is making their own choice, they have autonomy over what service they're getting, it's going to be the client. It doesn't matter if you think it's wrong. And you should probably speak to your supervisor or go to clinical supervision and kind of work through it. Because sometimes it's not always black or white. You may really truly believe something is wrong or it goes against what you believe. But again, as a profession, our standards, we agree to work under a certain standard and to show up in a particular way. Question 6. What is the primary purpose of professional code of ethics for addiction counselors? A, to provide specific instructions for every clinical situation a counselor may encounter. B, to establish the legal requirements counselors must follow when providing addiction services. C, to define the treatment methods counselors are expected to use with all clients. Or D, to establish professional principles and standards that guide ethical conduct and decision making. What is the main purpose of a code of ethics for addiction counselors? Why do we have a code of ethics? The correct answer is D. The primary purpose of a professional code of ethics is to establish professional principles and standards that guide ethical conduct and decision making. D is correct because a code of ethics provides professional principles and standards that guide how addiction counselors should behave, make ethical decisions, and protect the people they serve. A is incorrect because a code of ethics provides guidance, but it cannot give a specific answer for every situation a counselor may encounter. As a matter of fact, sidebar, sometimes it can be very confusing and there can be many gray areas. For example, some of us are licensed therapists, but we also follow a code of conduct of other your license. So for example, you might have a licensed clinical social worker that follows the social worker code of conduct, but they're also an addiction professional, so they may follow the NADAC code of conduct as well. I am a licensed professional counselor and a licensed substance abuse treatment practitioner. I follow both the ACA code of conduct. I also study the APA code of conduct, even though I'm not a psychologist, but I like to compare. And then I also follow an addiction counselor's code of conduct, NADAC. And one semester I compared and contrasted all three. They're similar, very similar, but as with all professions, be clear on what is the standards and the code of conducts for each profession. Because remember, there's all types of addiction professionals, nurses, social workers, counselors. You may get an addiction specialization. You might work in law enforcement, corrections. All of these professions have their own code of conducts, and what may be acceptable in one profession may not be acceptable in another profession. So make sure that you're lining up your code of conducts and your ethics and understanding, your particular position, but also what's expected of you per your licensing board, per your profession. All right. Why B is incorrect. Some ethical standards may overlap with laws, but a code of ethics is not the same as a law and does not establish legal requirements. And C is incorrect because a code of ethics guides professional conduct, not which specific treatment method must be used with every client. A question like this, you're being tested about your knowledge of the purpose and function of code of ethics. So, on a few of the exams, there's a section for professional responsibilities and ethics. So, this is where you need to be clear on when you're testing in a perfect world, how should you be conducting yourself as an addiction professional in terms of boundaries, choices of intervention, client relationships, all of the decisions you make as an addiction professional. So just you need knowledge of the ethics as an addiction professional. And the skill, you need to be able to distinguish between ethical standards, laws, clinical procedures, and treatment approaches. Question 7. Which of the following is not a professional code of ethics an addiction counselor may be required to follow based on their professional discipline or credentials? A. NADAC Code of Ethics. B. ACA Code of Ethics. C. The NASW Code of Ethics. Or D. The SAMHSA Ethical Practice Standards. Which one is not a code of ethics an addiction counselor may have to follow? Let's look in the chat. Okay. I see some D's. You are correct. D is not a code of ethics. D is correct because SAMHSA, the Substance Abuse and Mental Health Services Administration, provides behavioral health guidance, resources, and best practices, but it's not a code of ethics. A is a code of ethics. That is the Association for Addiction Professionals. And NADAC is actually the one that oversees the NCAC 1 test, the NCAC 2, and the MAC exam. And they do have a code of ethics. B is incorrect because the ACA does have a code of ethics, the American Counseling Association for professional counselors. And C is incorrect because the National Association of Social Workers also have a code of ethics. A question like this is testing your knowledge of professional codes of ethics and the organizations associated with them. You need to be able to identify professional organizations and code of ethics that you fall under as an addiction professional. And again, I said it again, many of us are addiction professionals on top of other types of professionals, counselors, nurses, social workers, law enforcement, corrections. You may be a peer professional. So again, peers are addiction professionals, but they also work in a different type of way versus a counselor. They have different type of relationship with their clients. So just be clear on code of ethics and what's expected of you per your credential and per your job position. Question 8. A counselor is disciplined for violating confidentiality. The same behavior may also have legal consequences. What is the main difference between ethical discipline and legal consequences? A. Ethical discipline affects only the counselor's professional reputation, while legal consequences affect the counselor's ability to practice. B. Ethical discipline may affect the counselor's license or credential, while legal consequences may include fines, lawsuits, or criminal penalties. C. Ethical discipline applies when client harm occurs, while legal consequences apply when professional standards are violated. Or D. Ethical discipline is handled by the counselor's employer, while legal consequences are handled by licensing and credentialing boards. What is the main difference? Which one described it correctly? What's the difference between ethical discipline or legal consequences? The correct answer is B. Ethical discipline may affect the counselor's license or credential, while legal consequences may include fines, lawsuits, or criminal penalties. B is correct because a licensing or credentialing board may discipline a counselor's professional credential for an ethical violation. The legal system may impose consequences such as fines, civil liability, or criminal penalties when they apply. The same behavior can potentially result in both. A is incorrect because ethical discipline can go beyond reputation. Depending on the counselor's credential and governing body, consequences may include reprimand, suspension, or loss of your professional credential. C is incorrect because it's the reverse. Ethical standards govern professional conduct while laws establish legal requirements. Either type of violation may involve client harm. D is incorrect because employers may impose workplace discipline, but professional ethical discipline may also come from licensing boards and credentialing organizations. Legal consequences are handled through the legal system. A question like this is testing your knowledge of consequences of violating professional ethics versus the law. So you need to understand what are your legal requirements and legal liabilities as an addiction professional, and what are your ethical standards, and what is your requirement in terms of ethically practicing. The skill related to this is your ability to distinguish between professional disciplinary actions from legal actions and recognizing that one incident can involve both. Question 9. A client tells their addiction counselor that the word counseling feels stigmatizing and asks the counselor to act as their life coach instead. The counselor would like to continue working on the same treatment goals, but wants the services described as coaching. What is the best response? A. Use the title life coach with the client while continuing to provide counseling services under the existing treatment plan. B. Explain the counselor's professional role and responsibilities, maintain clear role boundaries, and discuss ways to make treatment feel more collaborative. C. Refer the client to a life coach because the client has the right to determine which professional role the counselor provides. Or D. Continue providing counseling under the counselor title, but incorporate coaching techniques whenever they better match the client's preferences. Which is the best response? Client has an issue with the word counseling, feels like it's related to stigma or stigmatizing. They want you to act as their life coach. Which is the best response? The correct answer is B. Explain the counselor's professional role and responsibilities, maintain clear role boundaries, and discuss ways to make treatment feel more collaborative. B is correct because counselors are responsible for working within their scope, but also having clear professional roles and boundaries. The counselor should acknowledge the client's concern, explain their professional role, and explore ways to make services more collaborative without misrepresenting the service provided. So this is another important ethical topic. It's really a hot topic right now on the internet about certifications, licensing, misrepresenting yourself. Not only if you don't have a license, but if you have a license, you can't present yourself as being able to do something outside of your scope. So it's very important to explain to your clients or be able to explain to people, the public, what you do. About 5 times a week, I probably get a call at my office of someone saying, "Hey, I need a psychiatrist. Someone referred me to you. I need a psychiatrist." And I immediately say, "Okay, we only provide counseling services, this service. I am a licensed professional." And I explain what that is. And they go, "Oh, I thought y'all all was the same. I thought a psychologist was a psychiatrist, was a therapist." So we bear the responsibility to be clear about our roles so the client can then have a choice, a clear choice. So we can't, now you can do different things, but I would say one, they should be separated. So if you do want to do life coaching, you might want to figure out a way, talk to someone, a lawyer or a supervisor or a clinician, how you can separate the two. Because if you do both life coaching and counseling, that can get a little muddy, that can be confusing. Also, if you don't have a license that requires you or allows you to work independently, in some states you cannot say that you work independently. You have to explicitly say, "I am a resident in counseling," or "I am a counseling in training." You have to explicitly say that because you're under supervision. So again, our licensing and certifications are not just a piece of paper. No, these are standards we have to work under. This is our profession. So it's not just easy. It's not just, okay, I go to school, I get a license. You really have to work within these standards and ethical limitations. A is incorrect because changing the title does not change the professional service being provided. A counselor should not describe counseling services as something else simply because the client prefers another title. C is incorrect because clients have the right to make choices about their care, but they cannot redefine a counselor's professional role. Referral may be considered if the client no longer wants counseling, but it doesn't have to be the first response. And D is incorrect because adapting the counselor's approach to the client can be appropriate, which makes it say this was like a good second place, but the counselor should first address the client's request and clarify the professional role rather than simply changing techniques. A question like this is testing your knowledge of your professional role as an addiction professional or addiction counselor, your scope of practice. So be clear about what you can do in your state per your credentials, understanding boundaries, and understanding client rights. The skill you need to be able to maintain role clarity. You need to understand how to explain to other people what you do, because people outside of the profession, they may not know what we do. We can't assume everyone understands what it means to be an addiction professional or addiction therapist. So you have to explain to people and be able to and be clear about it. You also need to be able to preserve therapeutic relationship with their clients while also explaining them what boundaries are in place and what you can and cannot do. Question 10. An addiction counselor holds a recognized counseling certification. The counselor markets themselves as both a certified addiction counselor and an addiction life coach. The counselor provides similar addiction-related services under both titles. What is the primary ethical concern? A. Counselors cannot provide both counseling and coaching services during the same period of practice. B. Coaching services must always be provided through a separate business from counseling services. C. Using both roles may create confusion about the counselor's professional role, credentials, and which standards apply to the services being provided. Or D. A certified addiction counselor automatically has the qualifications necessary to provide addiction life coaching. Which one is the primary ethical concern? So, you're an addiction professional, you're certified, you're also an addiction life coach. similar services but different. Provide similar services under both, but they're different titles. What is the ethical concern here? Okay. I see some C's. I see a lot of C's. The correct answer is C. Using both roles may create confusion about the counselor's professional role, credentials, and which standards apply to services being provided. C is correct because counselors must clearly and accurately represent their professional role, credentials, and services. Marketing as both a counselor and life coach can create role confusion if clients cannot clearly determine which service they are receiving and the professional standards that apply. A is incorrect because holding or using more than one professional role is not automatically unethical. You can do both. The concern is whether the roles are clearly defined and accurately represented. B is incorrect because the ethical issue presented is not how the counselor structures the business, it's clarity and accurate representation of professional roles. And D is incorrect because a counseling credential does not automatically establish qualifications for every other professional or role. A question like this is testing your knowledge of your professional identity, accurate representation, ethical boundaries, credentials, and your role clarity. So we need knowledge on who we are as addiction professionals and how we show up because we represent the profession. The skill you need to be able to recognize when multiple professional roles could confuse clients about the services they are receiving. So as a licensed or certified addiction professional, you need to be clear on what services you provide, even within the profession. So if you are a therapist and you only do outpatient counseling, you need to be clear that you're not a prescriber. You're not an addiction medical doctor. You're not an addiction nurse. You're not a nurse practitioner. So we have to be clear on all roles that we play. All right. Let's take a breather. That is hour 1. Hour 2 will focus on ethical decision making. Let me get a swig of my water. And let's see what's going on in the chat. We have about 2 minutes. Thank you, Letitia. No worries. Thank you for the first hour. Okay. Now I was doing so good. I'm doing so well on my eating habits. And my husband just texts me, "Hey, do you want jerk turkey wings?" I mean, that's not all the way. That ain't all the way left, y'all, but the jerk sauce might be a little. And the answer is yes, I want jerk turkey wings. I do. All right. Welcome to hour 2. If you're watching the playback, hello, hello, hello. And hello to the chat. Who's still with me? Who's still on board? That first hour goes by really fast. You trying to throw me off. You know I've been doing good. Yes, I do want jerk turkey wings. All right. Put a 1 in the chat if you can hear me clearly. All right. Jamie is still here with us. Hello, Jamie. Hope you're well. LaShawn is here. Teresa. Hall of Fame mover. All right. We're still rocking and rolling. Hour 2 is based on ethical decision making. Ethical decision making is important because as addiction counselors, we are going to encounter situations where the answer is not always obvious. A code of ethics gives us guidance, but it cannot tell us exactly what to do. Hello, Cicely. Hello, Maria. Yes, Jamie. We just Googled soul food because we're just tired of food. Like, we're a household. We always eat out a lot. That's bad, guys. Don't do that. So we were like, okay, we need to cook more. Then one night we was like, let's Google soul food because we don't want fast food. And it was a place that has jerk turkey wings. And we just randomly went there and they were so good. I really regret going there because now I'm not going to say no to them. Okay, let me get on track. I'm thinking about them now. Ethical decision making is also important to recognize when we need supervisional consultation. So remember, the role that we have is layered. We have look at all the information we're retaining as we're preparing for these exams. This is a lot of information, you guys. This is a lot of information on top of doing our everyday jobs for those of us who are already clinicians. Then you have to learn, the areas that you're rusty in, the areas that you don't work in every day. Again, I do outpatient counseling. I do community counseling. I don't do MAT. I don't do medication assistant treatment in clinics. I don't work in an inpatient treatment. So it's a constant flow of information that we have to learn in order to not only pass our addiction exams, but to also maintain our quality clinical skill set. So, and it's layered. We're working with people who are different in so many ways. Every client is going to be different. So again, the answer is not always going to be cut and dry. So we have to have a way of working through some of these issues that's ethical and ensure that we're doing the best for the client, making sure they're safe, making sure they have a choice and all of the above. Once a decision is made, we need to take the appropriate action and document our decisions. So remember, for the exam, remember ethical decision making is a process. You may be given several answers that sound appropriate. As a matter of fact, most exams, 3 of those answers are going to be like, oh, that sounds correct. Or all 4 answers can be correct in certain situations depending on the context. But remember, you're going to focus on what they're asking you in the question. So you can read all 4 answers and you're like, all of these answers are right. I don't see a wrong answer. Maybe they're just looking for the best and most effective answer. All right. Let's start hour 2. Question 1. An addiction counselor is working with a client whose mental health symptoms are significantly interfering with addiction treatment. The counselor recognizes that the client's needs are beyond the counselor's training and competence. What is the best course of action? A. Continue providing treatment while learning more about the client's mental health condition to avoid disrupting services. B. Refer the client to another provider once the counselor determines that progress in addiction treatment is no longer occurring. C. Consult with a supervisor or qualified professional and, if appropriate, coordinate a referral to a provider who can better address the client's needs while supporting continuity of care. Or D. Continue addressing the client's substance use concerns and recommend that the client independently locate a mental health provider for the additional concerns. Which is the best course of action? The most ethical course of action? So you're working with the client. They have significant mental health symptoms that are interfering with treatment. You, as the addiction professional, cannot meet these needs. Course of action. The correct answer is C. Consult with a supervisor or qualified professional and, if appropriate, coordinate a referral to a provider who can better address the client's needs while supporting continuity of care. C is correct because when a client's need exceeds the counselor's scope or competence, the counselor should seek appropriate consultation and facilitate a referral when needed. The transition should support continued care of the client and to avoid client abandonment. So if you're a client, you cannot care for your client or provide appropriate treatments that support them with health, safety, and recovery. First of all, it's okay. That's what we're trained for, to understand when it's beyond our scope. You talk with a supervisor or seek consultation so you can get backup and you get support from a professional that understands our standards, our practices, our legal liability. And then you support the client with getting the care they need. That can include maybe you do just the substance use piece and refer out, or you may need to refer the client out totally. Maybe the client needs inpatient medical treatment. Whatever it is, you're still supporting the client with getting what they need to be safe and supports recovery. A is incorrect because continuing education is important, but learning about a condition does not immediately establish competence to treat it. Continuing services outside the counselor's competence may not adequately meet the client's needs. B is incorrect. Say, oh, it's out of my scope. Can't do that. You might need to find another provider. Per our professional standards, you would support them with making the referral or actually getting in contact with the provider, of course, with the correct release of information. And you will make sure they get connected to someone who does practice within that scope. This question is testing your knowledge of scope of practice, professional competence, referral, and client abandonment. The skill you need to be able to recognize when it's out of your scope of practice. And you also need to understand how to successfully facilitate transition of care. So it's out of your scope. You're not competent to do that service. It does not mean you're incompetent as a counselor. It just means that is not within your wheelhouse, so don't try. Question 2. A member of an addiction recovery group repeatedly becomes aggressive towards other members, disrupts sessions, and makes comments that other members perceive as threatening. The behavior is beginning to affect the safety and progress of the group. What is the best response by the counselor? A. Remove the client from the group because protecting the safety of the other members takes priority over continuing the client's participation. B. address the behavior privately with the client, assess the safety concerns, seek appropriate consultation, and determine whether continued participation or a supported referral is appropriate. C, establish clear behavioral expectations with the client and allow continued participation as long as no direct threat of physical harm has been made. Or D, temporarily suspend the client from the group and allow the client to return once they demonstrate an ability to follow group expectations. Which is the best response? So you're running a group, a member or participant has been aggressive, disrupts, and makes inappropriate or threatening comments. What is your best response as the addiction counselor? The correct answer is B. Address the behavior privately with the client, assess safety concerns, seek appropriate consultation, and determine whether continued participation or a supported referral is appropriate. B is correct because as addiction counselors, we must consider both group safety and the individual's client's safety and treatment needs. The behavior should be addressed directly, safety concerns assessed, and then appropriate consultation used to determine the next step. If the client cannot safely remain in the group, the counselor should support an appropriate transition or referral. A is incorrect because protecting the group is important, making this a strong second option. However, automatically removing the client does not include assessment, consultation, or consideration of an appropriate transition of care. So again, ethically, if we are having a hard time with the client, a client is displaying behaviors that could be deemed as unsafe or perceived as threatening, or maybe you're just having a hard time with the client and things are coming up and it may be difficult and it may trigger things inside of you. That's why you gotta go to supervision. But we can't abandon clients. And this is your safety is not, I'm saying your safety is not at risk or anything like that. It's just a difficult, and you may be just having difficulties. We have to work through that because remember, we have to model for clients and people who are, professionally interacting with us. So we have to model these type of skills. And I'm not saying it's always easy. We have to model how to manage conflict, how to have hard and difficult conversations with clients, how to remove a client, how to safely consider them too, even the client who's being disruptive. Those behaviors are communicating something. Those behaviors mean they need a certain type of support. However, we still have to make sure the group is safe. So navigating that is not always easy. C is incorrect because setting behavior expectations may be appropriate, but the counselor should not wait for a threat. We shouldn't wait till it gets worse. So again, we have to model how to address difficult issues. We can't just say, "Oh, it wasn't a direct threat." We have to model how to address things and make spaces safe in real time, or how to deal with it. And D is incorrect because temporary suspension may ultimately be appropriate, but the counselor should first assess the situation and determine the clinically and ethically appropriate response rather than automatically choosing suspension. Again, we have to look at the situation, make sure we're maintaining safety, and make sure we're addressing both the group and the client that is displaying these behaviors. A question like this is testing your knowledge of group counseling skills, group counseling responsibilities, client safety, professional judgment, consultation, and appropriate referral. So the skill is balancing the needs of one client with the safety and therapeutic needs of the entire group. Fun fact, I did my residency when I was becoming a CSAT. I did groups. If you want to learn several different skills and you like challenges and stuff, run some groups. Do community based work and then run some groups. You learn like 5, 10, 15 types of skills all at once. It is really the most rewarding and challenging because you have to learn these skills in real time. You have to manage different personalities in real time on top of making sure everyone is feeling seen, heard, balancing everything, balancing your own stuff. It's really amazing. Like group work, yeah, I recommend it 100%. If you ever get a chance to work under somebody, if you've never done group work, obviously find you a good supervisor. You're going to learn so much. You're going to be challenged, but you're going to learn so much. You're going to be like, I didn't even know certain stuff about myself. Like, I didn't even know certain things agitated me. Like, you learn so much about yourself. You learn so much about people. You learn so much about conflict, conflict resolution. It's awesome. Try it out. Question 3. An addiction counselor is providing family counseling to a client and their family. During treatment, the couple asked the counselor to also provide marriage counseling, and the parents request that the counselor begin seeing their children individually while continuing to counsel the entire family. What is the best response? A. Provide all requested services because the counselor already understands the family dynamics and can provide consistent care. B. Begin the additional services after obtaining informed consent from each family member and establishing separate treatment goals for each service. C. Evaluate whether the additional roles are within the counselor's competence and consider potential conflicts, confidentiality concerns, and role boundaries before accepting or referring the additional services. D. Continue family counseling and automatically refer all marriage and individual counseling needs to separate providers to prevent any possibility of multiple relationships. What is your best response? You're doing family counseling. The parents want you to give them marriage counseling on top of being the counselor to the children individually. So you will both be the children's counselor, the marriage counselor for them, and the family counselor. What is your best response from an ethical lens? Let me see what y'all got going on in the chat. Justin says, I got to assist in IOP groups in a federally funded community health center. I love group process. Watching the clients educate and validate each other was wow. I could see them grow intellectually. Yes, thank you for sharing, Justine. Yes, you get to you become much more perceptive. You learn nonverbal communication, verbal communication, pattern recognition. You're like just people watching, kind of, because depending on the type of group you're facilitating, so you're like, wow, I'm learning so much. Okay, I see some C's in the chat. Hi, William. Welcome to our learning group. Happy to have you here. What exam are you preparing for, William? If you would like to share. I see some C's. All right. The correct answer is C. Evaluate whether the additional roles are within the counselor's competence and consider potential conflicts, confidentiality concerns, and role boundaries before accepting or referring for additional services. So, in a perfect world, if I had to give a cut and dry answer, it would be no. because I could see where there could be a boundary issue, a trust issue. So now you're the family counselor, but also you're working with the mom and dad. And then the question is, do you have the competence to be a marriage counselor? That's a whole nother. For me, I don't. I cannot do that. Yes, I'm a licensed professional counselor, but marriage counseling, that's a specific skill. And then you also, they want you to be the kids counselor. You see how that could be kind of. Now, when I was studying for LPC, I got a practice question about working in a rural area. It was a practice question. They said sometimes when you consider working in a rural area, because there are a lack of providers, you may see people who are related, and then you should put things in place. But this question is not asking that. So the correct answer would be C. You want to evaluate the roles. Like, would this work? What would be some of the issues? What are potential conflicts? So once you start working with the family in, the individual setting, when you come back to the family setting, are people going to think, oh, now you're working with them, there's favoritism towards this person, or y'all talked about something else in individual counseling? Did you tell them this? Or this can get a little confusing. So C would be best. You would, again, seek supervision, talk to a supervisor, work through what would this look like, because they're asking for continued working with the family as a whole and in other types of settings with different types of therapy. That can get kind of confusing. Taking on several roles within the same family can create conflicts, unclear boundaries, and confidentiality concerns. The counselor should first evaluate whether the additional services are appropriate within their competence and ethically manageable. Consultation may also be appropriate before deciding whether to provide or refer for additional services. And I would also like to clarify, it's different from providing care for a client and you are incorporating family sessions to work towards that individual's goal, because you may be providing addiction counseling services to an individual and bringing in a family member in order to work towards that individual's goal. That is different than what we're asking here. This family wants you to be everyone's therapist, the family therapist, the individual therapist, and the marriage therapist. That probably wouldn't work, but you can work with families and other people in the client's life as long as you can clinically be able to see how it would benefit, but you're not their therapist. I hope I'm being clear on that. It's a part of the individual client's treatment. So that right there is fine. But when you say, yes, I can be the whole family's counselor, that may be an issue. A is incorrect because knowing the family well does not automatically make taking on additional counseling roles appropriate. Being familiar with someone can actually make the role and confidentiality more complicated. B is incorrect because informed consent and separate treatment goals are important, but they do not automatically resolve potential conflicts of interest, role confusion, or confidentiality concerns. And D is incorrect because a referral may ultimately be the best decision, but providing multiple services to members of the same family is not automatically prohibited in every situation. So it's not always prohibited. Like I said, I had a practice question and they was like, what about in a rural area? And where there's a lack of providers and you have to see a parent and a child. Then you will put things in place. You will document, you would seek supervision, you would seek consultation. The counselor should first evaluate the ethical and clinical concerns. A question like this is testing your knowledge of multiple roles, professional boundaries, confidentiality, informed consent, competence, and conflicts of interest. The skill you need to have is you need to be able to recognize when a counselor should evaluate your ethical risk before expanding your role or working with another client or family member. Okay. Please put a 1 in the chat if you can hear me. We're rocking and rolling today, you guys. Thank you, thank you. So glad my Wi-Fi got some act right tonight. Question 4. An addiction counselor believes that complete abstinence is the most effective approach to recovery. A client states that they are not ready for abstinence and would like to begin reducing substance use and related consequences. The client's proposed goal is clinically appropriate and consistent with available treatment options. What is the best response? A. Recommend abstinence as the primary treatment goal while allowing the client to decide whether they are willing to pursue it. B. Discuss the benefits of abstinence and harm reduction equally while explaining that the counselor professionally prefers an abstinence-based approach. C. Explore the client's reasons for choosing harm reduction and determine whether the client's goals reflect sufficient motivation for treatment. Or D. Recognize the counselor's personal beliefs, avoid allowing those beliefs to direct treatment, and collaborate on an ethically and clinically appropriate goal. What is your best response? The counselor believes that the client should stop abstinence. No use is the most effective approach to recovery. The client is not ready for no use. They would like to decrease their use. And the client has proposed a goal that is appropriate and consistent with treatment options. What is the best response? Okay. Okay, I see a C. What is the most ethically appropriate answer? The correct answer is D. Recognize your personal beliefs, avoid allowing those beliefs to direct treatment, and collaborate on an ethically and clinically appropriate goal. D is correct because the counselor must separate personal morals and values from professional ethics. The counselor can have personal beliefs about recovery, but those beliefs should not be imposed on the client when the client is choosing a clinically appropriate treatment option. A is incorrect because this preserves the client choice, which makes it almost the correct answer, but the counselor is still allowing a personal belief about abstinence to determine the primary treatment goal. B is incorrect because providing accurate information about different approaches can be appropriate, but telling the client which approach the counselor personally prefers may unnecessarily influence the client's decision and introduce the counselor's values into treatment. And C is incorrect because exploring motivation is clinically appropriate, but choosing harm reduction does not alone indicate insufficient motivation. The counselor should not evaluate the client's readiness based on whether the client chooses the counselor's preferred recovery pathway. A question like this is testing your knowledge of morals versus professional ethics, client autonomy, and how to separate the two. The skill you need to know is how to separate your personal beliefs and your moral compass from professional decision making while supporting safe, ethical, appropriate client choice. Question 5. A former client sees their addiction counselor at a restaurant and approaches to say hello. The former client invites the counselor to join their table for a celebration and offers the counselor an alcoholic drink. What is the best response? A. Join the table briefly but decline the drink, since social contact with a former client may be appropriate when treatment has ended and confidentiality is maintained. B. Decline the invitation but accept the drink away from the table, since the primary ethical concern is avoiding a social relationship with the former client. C. Thank the former client, politely decline both offers, and keep the interaction brief without acknowledging the formal counseling relationship to others. Or D. Ask the former client privately whether they are comfortable with the counselor joining the celebration before deciding how to respond. What is the best ethical response? So from an ethical lens, because all of our questions are based in professional standards and ethical considerations. So you're out at the restaurant, you see a former client, they invite you over and offer you a drink. And again, this is based on our professional standards, what's expected of us as counselors and addiction professionals. Let's see what you guys are saying at the chat. Okay, what is the best answer, the most ethical and best answer? Okay. See, I see a few C's. The correct answer is C. Thank the former client, politely decline both offers, and keep the interaction brief without acknowledging the former counseling relationship to others. Again, someone came under one of my videos and was like, you can accept gifts from clients. You can. I'm talking about our black and white professional standards. We can't have a dual relationship. So even something as, I guess, that would seem harmless to a person working outside of our profession, why you can't say hey to the client? Well, because who am I? If I see the client with the group and I come over and say, hey, how you doing? If someone asks who you are, you cannot say that. So you can't open the door to that. That is how important and how serious confidentiality is. Now, someone working outside of our field, power dynamics, and our professional ethics say, once I'm your therapist, I pretty much can't be anything else. I can have positive regard for you. I can want the best for you, but I can't see you in public and treat you as because someone is literally going to ask who you are. Now you have opened the door for questions. In exam world, anything that places you in a dual relationship with the client, immediately no. So don't overthink it. Now, again, for those of you who are watching this and who don't work in the field and you're considering becoming an addiction professional or addiction therapist, you might just think about, again, how you want to show up as a helper. Coaches, sometimes people who act in a peer setting, they go out with their clients because they provide that type of support. That's different than a therapist. As a therapist, it will absolutely be C, and it will be very brief and shoo, because you don't want to have to answer questions. You don't want to open that door. As a addiction therapist, we don't hang out with our clients. We are not our clients' friends. And I know that might be hard to hear. We care about our clients deeply. We want the best. We support them in some of their most vulnerable moments. However, we do not have dual relationships. We are the therapists. Sometimes that's hard to hear, but it's true. That is just what happens when you decide to be a clinical therapist. Again, if that's too restrictive, you might want to consider another role. If you're watching this and you're not a clinician yet, if you're already a clinician, you already know what I'm talking about. So ethically, C would be the best. And for any questions that's set up like this, you can't accept gifts. You can't go out. You might want to stay away from events where you're engaging in activities that may put you in a situation where you're seen as a friend, a family member, a romantic partner. All of that is unacceptable as an addiction therapist, counselor, someone who's expected to keep those boundaries. All right, A is incorrect because the counselor declines the alcohol and intends to protect confidentiality. However, joining the celebration can still create a social relationship. It can blur boundaries. You don't want to blur boundaries. And it's easy to blur boundaries. B is incorrect because declining the invitation protects one boundary, but accepting the drink from the former client will introduce another unnecessary social interaction. The concern is broader than simply sitting at the table. And D is incorrect because client preference is important and discussing boundaries can sometimes be appropriate, but the former client's permission does not remove our responsibility to maintain professional boundaries and confidentiality. So remember, we hold the weight of maintaining the boundary. Even if your client says, "Oh no, I will tell everybody you were great. You helped me. You helped me in my darkest moment. I want to yell to the rooftop." Again, this should be discussed at the onset of services. All of this is discussed about social media, about dual relationships, about if you see each other, especially if you live in a small town, you have to discuss these things with your clients because ultimately we hold the responsibility to keep the boundaries where they're supposed to be. Again, some people just don't know. They don't understand because they don't work in the profession. So it always falls on us to maintain the boundary. And of course, in a respectful and empathetic way. And, explain to them what our standard is in our profession and what our role is. A question like this is testing your knowledge of boundary setting, confidentiality, and professional conduct. A skill that you need to learn is recognizing that client permission does not automatically make boundary decision ethically appropriate. Again, lots of gray areas, lots of boundaries crossed when you talk about morals, legal issues, and ethical practice. So have, knowledge of different situations that may arise and how you are expected to respond to it. Question 6. An addiction counselor has been working with a teenager who continues to use substances despite several counseling interventions. The counselor begins feeling nervous about their abilities and wonders whether they are effective as an addiction counselor. What is the best response? A. Refer the teen to another counselor because continued substance use suggests the current counselor may not be effective. B. Continue using the current interventions for several more sessions before seeking consultation, since behavior change often takes time. C. Review the client's progress and treatment approach, seek supervision or consultation, and identify whether changes in interventions or additional training are needed. Or D. Discuss the counselor's concerns with the teen and ask whether the client believes the counselor's interventions have been effective. So you're working with the teen. They continue to use. They're struggling with achieving abstinence or recovery. And the addiction counselor begins to feel like they're not good. They wonder if what they're doing is even working or effective, and if they need to refer them out or quit or what. What is the best response? Thank you, Doreen. Great. Good to see you back, Doreen. What do you guys think? What is the best response? C is the best response. Review the client's progress and treatment approach. Seek supervisional consultation and identify whether changes in interventions or additional training are needed. C is correct because addiction counselors should engage in self-evaluation and use supervisional consultation when questioning their effectiveness. The counselor can review what is and what is not working. They can consider different interventions and identify areas of professional development without automatically assuming the client or counselor has failed. That is the beauty of supervision and ongoing learning. Being able to check in to see, is this just your perception of yourself? Because relapse and these types of struggles are a part of treatment. And we have to be able to talk to someone else, your supervisor or your clinical supervisor, to see, am I being too hard on myself? Why do I feel like this is not working? Or why is my immediate response to a client struggling with substance use is that what I'm doing is wrong, when the whole point of substance use counseling and treatment is to support them with working through relapse and using and things like that. So maybe the expectation. So again, these are the things you can work through as a professional. A is incorrect. Referral may eventually be appropriate if the teen's needs exceed the counselor's competence, but continued substance use alone does not establish that the counselor is incompetent or the referral is immediately necessary. B is incorrect because giving treatment more time may sound reasonable, but continuing the same approach without evaluating effectiveness does not address the counselor's concern or the client's lack of progress. And D is incorrect because client feedback can be valuable, but the counselor should not place responsibility on the client to determine the counselor's professional competence. A question like this is testing your knowledge of your ability to self-evaluate, your professional competence, your knowledge, how you understand how supervision works, consultation, and professional development. The skill that you need is the ability to recognize when to evaluate your own practice and when to seek professional guidance, rather than automatically continuing treatment or referring the client, or automatically thinking that you're not doing what you're supposed to do. So again, supervision and consultation falls under the professional practice and standards on most of the big 5 addiction counselor tests. They mention supervision, and that's for a reason, because we are committing to being lifelong learners as addiction therapists and addiction treatment providers, because there's always something being developed. There's always changes in client populations. There's always something to learn. New techniques, new interventions, again, new research. Something may change within us. We may start working with a new group. There's so many different factors. So you must constantly be able to check in with someone so you can make sure, you're working to your best ability. Question 8. Oh, did I skip one? I skipped one. Sorry, guys. How did I skip question 7? We're going to 8. An addiction counselor determines that a client receiving outpatient treatment now needs a higher level of care because their needs can no longer be safely or effectively managed in the current setting. What is the best response? A. Continue outpatient services while giving the client information about higher levels of care so the client can decide when they are ready to transition. B. Discuss the recommendation with the client and continue the current level of care until the client independently establishes services with another provider. C. Explain the clinical need for a higher level of care, provide appropriate referrals, help coordinate the transition, and take reasonable steps to support continuity of care. Or D. Begin the discharge process and provide several treatment options so the client can independently select and contact the provider that best meets their needs. What is the best response? So you're an addiction counselor that determines that a client needs a higher level of care. So if you're doing outpatient, they might need inpatient or IOP or PHP because their needs can no longer be safely or effectively managed. What is the best response? Okay, I see a few C's. Okay. The correct answer is C. C is correct because when a client needs services beyond what you can provide, the counselor should facilitate an appropriate transition of care. This includes discussing the recommendations, providing referrals, assisting with coordination, and avoiding abandonment. You've heard that word a few times tonight. A is incorrect because client involvement in treatment decisions is important, but the counselor should not continue providing a level of care that has already been determined to be inadequate. B is incorrect because continuing care during a transition may sometimes be appropriate, but placing the full responsibility on the client to establish the next service does not adequately address coordination and appropriate continued care process. And D is incorrect because providing treatment options is appropriate, but just giving the client referrals and expecting them to manage the transition by themselves may not be sufficient when a higher level of care is clinically necessary. What you're being tested on a question like this is your scope of practice, your knowledge of levels of care. I have a levels of care video, you guys. So whenever you get finished, you can go over to the practice questions and there's a level of care video on the playlist. Ethical termination, referral, and non-abandonment. So the word abandonment keeps coming up. If you're not an active clinician and you're watching this, that means we cannot just get rid of a client. Even if you're doing, in some instances, you might be doing a consultation or you may just be doing a screening. Ethically, we need to be able to recognize when a client needs that extra support. So let's say you're working with a client, you do a screening, you say, oh, this client may need some type of detox. This client cannot start with outpatient counseling. I've done a screening. They have, medical conditions. They're showing signs of withdrawal. And I need to support them with connecting them to a provider that can give them this care. Your client may not be able to take the number. You can't just simply be like, okay, here's a list of detox centers. We're agreeing that because we have the skill and the ability, we're going to support within our means. And that means we cannot work with the client, but maybe you can make a phone call right then. Maybe you can give the client the list of the providers, but also call the providers and do, again, the warm handoff, the connection, or just sit there and support them with scheduling the appointment. That way, those are 2 or 3 steps that you've already gotten out of the way so they can go ahead and get the care they need. The skill you need to know, recognizing how to transition a client to more appropriate care while maintaining continued care and protecting the client's welfare. Again, sometimes it's just literally a phone call that takes less than a few minutes. Question 9. An addiction counselor is selecting an intervention for a client with substance use concerns. Several approaches could be appropriate, but the counselor has different levels of training and experience with each. Which action best reflects professional standards of practice? A. Select the intervention most strongly supported by current research, even if the counselor has limited experience using it. B. Select an evidence-based intervention that fits the client's needs and is within the counselor's demonstrated competence. C. Select the intervention recommended by the counselor's agency, provided it is commonly used with clients who have similar concerns. Or D. Select the intervention the client prefers, provided the counselor explains the possible benefits and limitations of that approach. Which one of these answers best reflects professional standards of practice? So, an addiction counselor is trying to figure out what interventions to use to support and work with the client. The counselor is trained on just a certain intervention, not all the approaches. They're trained more in certain approaches. What's the best answer? Okay, let's see what you guys say. Okay, I see a couple B's. The correct answer is B. Select an evidence-based intervention that fits the client's needs and is within the counselor's demonstrated competence. B is correct because professional standards requires us as addiction counselors to consider both the client's needs and our own competence. An intervention may be evidence-based, but the counselor must also have the appropriate knowledge, training, or supervised experience to use it responsibly. A is incorrect because using evidence-based practices is important, which makes this this may be one of the answers that somebody might choose if they're just not looking through or they're not reading through it enough and mistakenly could see this as the right answer or the best answer. But the strong research support does not automatically make a counselor competent. So you can be aware of an evidence-based approach, but you may not have the appropriate training to use it. C is incorrect because agency recommendations can help guide practice, but agency preference does not replace the counselor's responsibility to determine whether an intervention is appropriate for the individual and within the counselor's competence. And D is incorrect because client preference is an important part of treatment, however, informed client choice does not allow a counselor to provide an intervention that is clinically inappropriate or outside their competence. A question like this is testing your knowledge of professional standards, competence, evidence-based practice and interventions, and individualized care. The skill you need to be able to consider client needs, clinical evidence-based practices, client preferences, and your competence when making professional decisions. So a lot of moving parts, but it's actually doable. These are the questions, and this should guide your questions in consultations and intakes, because sometimes your client may have heard about a certain approach, or they have a certain preference, or they may say, I had therapy before, I had treatment before, and I really enjoyed this. And if they can't tell you the specific intervention, they might be able to describe it and you may be able to get an idea of what worked for them or what they enjoyed. And then you consider if that's within your competence, or if that's an intervention you can implement into treatment. Question 10. An addiction counselor has maintained the same credential for several years and consistently completes the minimum required CEUs. However, the counselor has not pursued training on newer approaches now commonly used with the population they serve. Which action best reflects the counselor's professional responsibility? A. Continue meeting the required CEUs because maintaining the credential demonstrates that the counselor remains professionally competent. B. Seek additional training only when a supervisor identifies a concern with the counselor's current clinical performance. C. Continue using established approaches until the counselor's agency formally adopts newer practices as part of its treatment standards. Or D. Identify areas where current knowledge or skills need strengthening and pursue relevant education, supervision, or consultation to maintain competence. Which response best reflects our responsibility as addiction professionals? So we're getting our education credits every year to maintain our licenses, but this counselor has not pursued any new training or anything that can develop their current skills. They're just basically taking the CEUs just to fulfill the minimum requirements. The correct answer is D. Identify areas where current knowledge or skills need strengthening and pursue relevant education, supervision, or consultation to maintain competence. So our professional responsibility is to have ongoing education to develop our skills. So not simply just completing the CEUs. Addiction counselors should evaluate their skills, stay current with developments in the field, and seek education, supervision, or consultation when needed. A is incorrect because maintaining a credential is important, but completing required CEUs does not automatically mean the counselor's knowledge and skills remain current. B is incorrect because counselors should evaluate their own professional development needs rather than waiting for a supervisor to identify a problem. Or C is incorrect. Agency practices are important, but counselors also have an individual responsibility to remain informed about current practices relevant to their work. So for example, let's say someone retired in 2020 or 2015, 2010, and they want to come back part-time working with a specific population where there's a learning curve. Let's say they work with adolescents, or they work before vapes, or the explosion of vapes. As the addiction counselor, they're responsible for catching up on some of the gaps in research, some of the changes in society. Because in the 90s, early 2000s, that was still more cigarettes. Now is all type of vapes and nicotine vapes and marijuana vapes. You have to wrap your head around, and then you got to have a different approach. What is working? Like nicotine cessation and things like that. So just being licensed and certified is probably not going to be enough. Every year there's new research, new changes in society, expectations. Different clients have different cultural, all of that. We have to consider all of that. So our CEU should reflect areas that we are knowledgeable in, but we still want to continue to grow and learn more. The skill you need to have for a question like this, you need to recognize that we as addiction professionals are responsible for continuing our education, personal and professional development, and evaluating and developing our own knowledge and skills. All right. Hour 2 is done. I'm going to stand up and stretch. Woo! Deep breath. Hour 2 is done, guys. We are almost finished our 4th intensive. If you're just joining us, welcome to hour 3 of our last 3-hour intensive study group on addiction counselor exam prep for this quarter. We're going to do it again in December. We won't have a study group live for the next 2 weeks. We'll pick back up in the middle of recovery month in September. The 3rd week, we'll go back to 7 o'clock, 1 hour. I will send reminders. I will post on the community tab. I'll remind you guys. We're not going to be starting at 6 because we're not doing the 3 hour. We're going right back to our 7 to 8, 3rd week of September of recovery month. For the next 2 weeks, I'll be doing events and trainings for recovery month. Adjusting to my fall schedule. So I'm, slowing down a little bit, but I will be posting pre-recorded videos, but we'll be back live 3rd week in September. Okay. Who's still with us? I'm going to take a stretch. Then we're going to knock this 3rd hour out. If you're new to our learning community, in the description, I have links to the study playlist. So we have a addiction counselor, addiction terms playlist. So if you're new to the profession, you're new to studying, or you just want to spruce up, that's a playlist where I just go over terms, addiction counselor terms. We also have a playlist for just practice questions. Those are my fave. I love sitting down and developing practice questions and trying to develop questions that hit on the main topics. And then we have the first playlist that I developed, the core functions playlist. So those are the 12 tasks or core functions that we do as addiction counselors or counselors. And there's a main video. And then there's 12 additional videos for each core function. So whenever you have free time. Oh, Maria, please be safe. I hope I'm on Bluetooth. But if not, prioritize driving and then catch us on the playback. Please focus. The 12 core functions playlist is for anyone who is preparing for exam prep for any of those top exams or certifications. And it's just a reminder of all the things we do. We do screening, we do assessment, we do orientation, we do diagnosing, we do case management, we refer out, we provide client education. So it's just like a recap of all of the 12 main things we do. And then I have a video for each. If you have not already joined my email list, you can join by following the Stan Store link. And I have a free resource. When you download that free resource and you provide me your email, I put you on my email list and I send an email once a week reminding you of this live. I may send a video if I have a pre-recorded video, and I'll send it to you and remind you that it's been posted. But I promise not to send you 1,000,001 videos. It's just to keep in contact so we can stay in touch. In case anything happens with these social media platforms, we can always have a way to reach out and continue to study and connect and develop our skills as clinicians. So again, if you're new to the group, welcome. Welcome to hour 3. If you've been here, welcome back, study partner. We're going to knock this 3rd hour out. I got my stretch in. Okay, great, Maria. Thank you. Right. Hour three is focused on legal topics and laws. For this last hour, we'll focus on legal related issues and laws related to what we need to understand for addiction counselor exams. This section is important because counselors have both ethical responsibilities and legal obligations. There are actually specific laws that we have to be familiar with that protects client confidentiality and privacy. We'll also look at informed consent and client rights. And finally, remember laws and regulations can vary by state and jurisdiction. So you must be aware, even if you're not tested on specific state mandates and laws, you have to remember there's layers. So we have federal and legal obligations and laws that we have to understand, but also each state is different. But for your exam, just be aware of our standards, our professional standards in terms of legal liability. So for exam questions, when you are studying law and legal topics, it's probably always going to fall under ethical and professional practices. You have to ask yourself, is this an ethical issue, a legal requirement, a confidentiality issue, a morality issue, or somewhere in between or all? Excuse me. So you have to be able to have the distinction so you can make the most appropriate decision. Question 1. Why is confidentiality especially important in substance use disorder treatment? A, because substance use disorder treatment records cannot be disclosed under any circumstances without the client's written permission. B, because disclosure of substance use disorder treatment information can expose clients to stigma and other harms that may discourage them from seeking or continuing treatment. C, because addiction counselors have greater confidentiality responsibilities than other behavioral health professionals, regardless of the treatment setting. Or D, because information discussed during substance use disorder treatment receives the same protections as privileged communication in every setting. Why is confidentiality important in substance use treatment? Okay. The correct answer is B. B is correct because people may avoid addiction treatment if they fear that information about their substance use or treatment could be disclosed. Strong confidentiality protections help protect our client privacy, support trust, and reduce fear of negative consequences associated with disclosure. A is incorrect because substance use treatment records receive strong protections, but confidentiality is not absolute. There are specific circumstances in which disclosure may be permitted or required. If you look in our previous lives, we talked about confidentiality, and there are times where we can ethically and legally break confidentiality if the client's life is in danger, if there's a safety issue. C is incorrect because addiction treatment information may receive additional protections under laws such as 42 CFR Part 2, but those protections depend on whether the program and information fall under the applicable requirements. And D is incorrect because confidentiality and legal privilege are related but not the same concept. The protections that apply depend on the circumstances and laws. A question like this is testing your knowledge of the purpose of confidentiality protections in substance use disorder treatment. So you have to have a clear understanding of why confidentiality and privacy is a pillar of the counseling profession, period. Our profession is driven by confidentiality and privacy, because without that, none of this works, because we won't have the trust of our clients. So it's a pillar, it's the foundation. The skill you need is understanding why privacy is particularly important in addiction services. Also, understanding confidentiality rules, when it can be broken, when it cannot. What steps needs to be taken to share client records or confide about treatment. Question 2. Which statement best describes a difference between HIPAA and 42 CFR Part 2 regarding substance use disorder treatment records? A. HIPAA and Part 2 generally allow disclosures without separate client authorization. B. HIPAA requires client authorization, while Part 2 permits these disclosures without consent. C. HIPAA generally permits disclosures, while Part 2 requires client consent for protected records. Or D. HIPAA requires written consent for each disclosure, while Part 2 allows one consent for all disclosures. Which statement best describes the difference between HIPAA and 42 CFR Part 2? I also have a 42 CFR Part 2 video. If you go under practice questions and the education playlist, practice questions playlist and education playlist, or you can search 42 CFR Part 2 or client confidentiality. The correct answer is C. C is correct because HIPAA generally permits certain disclosures for treatment, payment, and healthcare operations. That's what TPO stands for, without separate client authorization. Part 2 provides additional protection for substance use disorder treatment records and generally requires client consent before protected Part 2 records are disclosed. So sometimes you'll see an additional blurb or an additional release specifically regarding substance use treatment records, or a checklist. And the easiest way to remember is 42 CFR has extra protections for substance use treatment records. So both are confidentiality and privacy laws, federal laws, but 42 CFR just has a few extra protections for substance use treatment. A is incorrect because Part 2 does not simply follow HIPAA's general permission guidelines. Additional Part 2 requirements apply. B is incorrect because this reverses. This is a reverse answer, which is incorrect. HIPAA generally permits certain disclosures without separate authorization. And D is incorrect because HIPAA does not generally require a separate written authorization for every disclosure. Updated Part 2 rules also allow a client to provide a single consent covering future uses and disclosures. So again, those are those extra protections. So previously, there has been some recent changes, but previously, there will have to be a new disclosure form for each new disclosure, not just a blanket release for how HIPAA works. A question like this is testing your knowledge of HIPAA, 42 CFR Part 2, and confidentiality laws that we have to follow as addiction counselors. The skill you need to be able to recognize confidentiality protections, specifically for substance use treatment records. So you might be tested on your knowledge of how to share information, how we share information for the care of our clients. And it's not just simply a release of information form sometimes. There are specific disclosures and extra steps you may have to take when it comes to providing substance use treatment. And that's for the safety of our clients, due to stigma, due to retaliation. Question 3. An addiction counselor is developing an informed consent and fee policy for a new private practice. Which approach best reflects professional standards regarding financial arrangements? A. Review the basic session fee before treatment and explain other financial policies as they become relevant. B. Clearly explain fees, billing practices, cancellation policies, and applicable insurance procedures before service begin. C. Provide written fee information before treatment and discuss specific billing expectations during the initial counseling session. Or D. Review financial expectations during intake and allow individual arrangements to be established as treatment progresses. Which one of these answers best reflects professional standards, particularly from an ethical lens? I wanted tonight's questions to be more not so much gray areas, but like the everyday tasks we do as addiction professionals, not the ones that we obviously know how to do. We know not to hurt a client. We know how to handle a client with care. Those are assumed. Most of us are clinicians here. But some of the everyday tasks we do, like fee, like talking to a client about how much they're going to pay or what insurance coverage it is. How do you see that from an ethical lens? Because sometimes there can be a gray area, and some people can be ethically unsound and not be aware of it. So we know impact doesn't, change whether you meant it or not, but sometimes there can be an ethical violation because of lack of knowledge. So some of these questions I wanted to not just be so out of this world. Most of us are in this field because we want to help. We want to be trained. We want to, provide support. But we also have to understand, ethical limitations and certain mistakes that people have made, so we're aware. All right. The correct answer is B. B is correct because clients should understand their financial responsibilities before services begin. I reviewed this question with a training I did with interns. And the question was, is it unethical to not handle client fees appropriately? And the question is yes, because you can't just spring fees up after you've started. And you may not mean any harm, but it doesn't mean it doesn't harm the client, because think about the work we do. There may be already financial strains. There may be issues with, finding time to even get treatment and having the motivation and be thinking about what will people think, stigma. And you start the sessions without being clear on copay or what they need to pay or what needs to be covered. And you start treatment, and then in the middle of treatment, you goes, oh yeah, you owe me, you got to pay me $150 or $200, or the insurance didn't cover this. That's ethically irresponsible, because now, you may rattle the client or bring up something, or it just seems not together and not organized. So it should be done at the beginning so you're clear. So if there's any issues or barriers, it could be worked out from the beginning. There's no surprises. This includes fees, billing practices, cancellation policies, and applicable insurance procedures so the client can make an informed decision about receiving services. A is incorrect because providing the session fee is important, but other known financial policies should also be explained before treatment rather than waiting until they become relevant. So they can't come up as they go. You need to talk about cancellation fees, copay policy. What is considered a late fee? Do you accept late payments? All of that should be explained in the beginning through the organization of practice or you yourself as the clinician. C is incorrect because providing written information is appropriate, but important billing expectations should be clearly established as part of informed consent before services. Remember, A part of ethical practice is making sure your client is educated and knowledgeable about what's about to happen, what treatment, what services they're getting ready to receive, and you need to be able to ensure that they understand. So you explain it on their level. It has to be culturally competent, and you support them with understanding if there's an issue with communicating their rights and their informed consent, because they have to be able to make a decision with all of the information. If we don't do our due diligence to support them in making a fully informed decision, that would be unethical. And it has to happen before services begin. D is incorrect because individual financial arrangements may sometimes be appropriate, but the counselor should still establish clear financial expectations at the beginning of the professional relationship, even if they don't have to pay anything. Even if they don't have to pay anything, if their insurance is covering 100% of the service, you still want to be transparent, and you review with them that what information you're providing to the insurance company, how much this insurance company is covering per session, things like that, so that you're transparent and you're open, because it's still their insurance. Even if they're not paying anything out of pocket, they could be paying through their job, or even if it's a state funded insurance. A part of the informed consent and transparency is them understanding the service as a whole. A question like this is testing your knowledge of informed consent, financial arrangements, and fee policies. Thank you so much, Doreen. I appreciate your support of the channel. The skill you need for a question like this to practice and pass your exam is establishing clear information for your client before the counseling relationship has started and throughout. But most importantly, the open communication and informed consent should start before services. Now, if anything changes mid therapeutic relationship, that's not in our control. Let's say insurances get lapsed or something happens. Again, you update the client and you work out what you would do moving forward. But before services start, informed consent should be clear. Question 4. Which situation could create legal consequences for an addiction counselor? A. Using a treatment approach that differs from the counselor supervisor's preferred clinical approach. B. Continuing counseling when a client is making limited progress towards established treatment goals. C. Choosing not to maintain membership in a professional addiction counseling organization. Or D. Providing services outside the counselor's legally authorized professional scope of practice. Which one can create legal consequences for an addiction counselor? Okay. Okay. Now read each answer carefully and think about which one of these can be a legal thing that a counselor can have legal consequences for. The correct answer is D. Providing services outside the counselor's legally authorized professional scope of practice. D is correct because counselors must practice within the scope permitted by their credential and jurisdiction. Providing services beyond that authority can result in regulatory or legal consequences, and that includes calling yourself something that requires a license, or to go back to our old question, like when you're marketing, make sure you're marketing for the service that you are legally certified or licensed for, and you can provide that you've received the training, that you have the license and you received the training. And I say beyond license, because we can all be licensed and certified. And let's say someone calls and wants a specialty like EDMR. Just because you're licensed, you can't do that. You have to be certified and trained on that. So it's not only the certification or the license, it's the training. So once everyone passes, and everyone's going to pass in here, if there are certain areas that you want to, specialize in beyond just addiction treatment, you have to get training, and you have to show that you've done your due diligence to be trained in it before you provide services to clients. A is incorrect because a difference in clinical approach may require supervision or consultation, but it does not automatically mean the counselor has violated the law. So that wouldn't be a legal issue. B is incorrect because limited progress does not automatically create a legal issue. The counselor should reassess treatment and determine whether changes are needed. And C is incorrect because professional association membership is different from licensure or certification. Not belonging to an association does not automatically create a legal violation. Belonging to an association is showing your due diligence of, contributing to the profession, being a part of the profession, initiating and upkeeping learning and continued education. But you're not necessarily going to have a legal consequence if you don't maintain affiliation. A question like this is testing your knowledge of your scope of practice and legal and professional responsibilities. A skill you need is knowing the difference between legal requirements and clinical and professional expectations. So there are things that are not legally required or may not even be required per your licensing, but under your ethical practice, would you want to just not learn something new? Let's say you've been a clinician 20, 30, 40 years. Professionally, you should want to be updated on new practices and changes in addiction counseling, just to be aware if you're actively working. Would you go to jail or have a legal consequences? Probably not. But professionally, the standard should be continued education and learning and developing. So again, understand the difference between ethical, moral, legal, professional. Question 5. An addiction counselor begins regularly socializing with a current client outside of treatment. Over time, the client claims that the counselor took advantage of the professional relationship and files a complaint. What is a potential legal implication of the counselor's boundary crossing? A. The counselor may be required to transfer the client if the social relationship begins affecting treatment progress. B. The counselor may face a malpractice claim or regulatory action if the boundary violation results in client harm. C. The counselor may receive additional supervision if the relationship creates concerns about professional judgment. Or D. The counselor may need to revise informed consent if contact out of counseling becomes more frequent. What is a potential legal implication? Now, the question before in hour 2 was more so like it was under boundaries, which is an ethical issue, but it was more so about optics and maintaining the professional boundary. But it was something that you could just, as the counselor, you decline to drink and you carry on. You make sure that there's no dual relationship. You can't sit down and party. For this question, what could be some of the legal issues you can get into by having a dual relationship, meaning interacting with the client beyond the treatment setting? Okay. Thank you, Jamie. I appreciate you. Not you contributing to my jerk wing issue. I appreciate you. Thank you so much. You guys are so kind. I appreciate you for supporting the channel. The correct answer is B. The counselor may face a malpractice claim or regulatory action if the boundary violation results in client harm. Now, remember again, when you have a therapist client relationship, if we're talking power dynamics, who always is going to have the power? Whether the client or you thinks it or not, it's going to always be us. So that means we have the responsibility to maintain the boundary. We have the responsibility to maintain appropriate therapeutic relationships. We also have the responsibility of explaining how we show up in our therapeutic relationship, because remember, everyone does not know. Even though there's 3,000 of us, right, and we know there's hundreds of thousands of practitioners all over the country, people who don't work in our setting, they don't know this. So we're responsible for educating our clients, educating people who don't work in the field on how we're supposed to show up. It's not their responsibility. So, yes, there may be legal consequences if the clinician crosses boundaries, if it can be even seen as a dual relationship. The addiction counselor is responsible for making sure that the boundary is not crossed, because again, it's assumed that the practitioner always has the power to make sure things don't cross boundaries. That could be a malpractice claim. Because if a client is coming in for support because they are not functioning daily, they may have a diagnosis that prevents them from making the most sound decisions. We are licensed, we are certified. So in this relationship, that means we are responsible for making sure we don't cross those boundaries that could cause more harm. We're not supposed to cause more harm. For the exam, dual relationships are no. B is correct because boundary violations can have consequences beyond ethical complaints. If a counselor's conduct breaches professional duties and contributes to client harm, the counselor may face regulatory action or civil liability. You can get sued or other legal issues, depending on the circumstances and jurisdiction. A is incorrect because transferring the client may be clinically appropriate in some situations, but it does not describe the potential legal consequence of the counselor's conduct. C is incorrect because additional supervision may be appropriate professional response, but supervision itself is not the primary legal implication presented in the question. And D is incorrect because informed consent does not make an appropriate boundary crossing acceptable. The concern is the counselor's conduct and potential harm to the client. I'm on social media. Immediately, there's a social media policy. There's a review of what that looks like if you see me, what that looks like if you see me online, because it is my responsibility to make sure that boundary is set. And when you get a chance, go over to the ACA, Google ACA Counselor Code of Conduct, and just look over the expectations, the ethical expectations for counselors. You might be surprised at some of the rules and ethical standards. But a lot of the professional ethics, since the rise of social media, agency policies, organizational policies have to be updated, more and more. Look at our agency policy and make the best decision that keeps our clients safe and us within ethical limits. Question 6. What is the primary purpose of a release of information in addiction counseling? A, to allow providers to exchange any information that may be helpful throughout the client's treatment. B, to document the client's permission for specific information to be shared with identified individuals or organizations. C, to protect the counselor when communicating client information with professionals involved in the client's care. Or D, to allow agencies to coordinate services without repeatedly discussing confidentiality requirements with the client. Which one is the primary, the main purpose of a release of information in counseling? What is the main purpose? The correct answer is B, to document the client's permission for specific information to be shared with identified individuals or organizations. B is correct because a release of information documents the client's authorization for specific information to be disclosed to specific individuals or organizations for an identified purpose, consistent with applicable, it's getting late, y'all, confidentiality requirements. So the release of information is the client giving permission for you to share specific information from their files, their treatment, your interactions. That can include notes, not progress notes, but maybe chart notes, all of that. Treatment recommendations, discharge summaries. A is incorrect because a release of information does not automatically allow providers to share any information that could be useful. Disclosure must remain within the client authorized and what rules permit. So again, if you don't actively work as the clinician, the release of information should be specific. So you should have the specific agency name on it or a specific clinician or the person who has permission for you to share information with and they have to sign one with any other provider or care team member to give you information. Usually there is a limit on the time frame. So sometimes people do 6 months, sometimes people do a year, sometimes they do specific time frames just for a limited release of information. There are best practices with release of information, like, again, client consent, informed consent. If you are supporting the client and you're talking about release of information, you are responsible for explaining to them what this means. So just because the client signs it and goes, yes, I want my husband, I want my job, and I want my psychiatrist who prescribes my meds, you can talk to them about my care. That's not good enough. You have to ask specific questions. Do you want me to share progress notes? Do you want me to share updates, summaries? Do you want me to be able to share this for a year, 6 months, just for the time that you're in treatment? It's not like a free-for-all. C is incorrect because a release of information can provide authorization for disclosure, but its primary purpose is to document the client's permission and choices about sharing information, not to protect the counselor. So it's giving the client autonomy over who gets to see what they're working on and what treatment they're receiving. D is incorrect because care coordination may be a reason for getting a release of information, but the client's confidentiality rights and disclosure requirements still apply. So care coordination is not the main reason, but giving the client autonomy over their care and who gets to see their treatment is the primary reason. So pay attention when you're taking your exams. They might say, what's the best answer? What's the primary answer? Or they might say, what is not? So make sure you're reading your questions carefully. Question 7. A client in an outpatient addiction treatment program states they no longer want to attend the anger management group, but they want to continue individual counseling. What is the best response by the counselor? A. Allow the client to discontinue the group because clients have the right to refuse any recommended service. B. Explore the client's reasons for refusing the group, discuss possible treatment changes, and review whether participation is required by the program. C. Continue recommending the group while allowing individual counseling to continue until the treatment plan is formally reviewed. Or D. Explain that refusing part of the treatment plan may affect services and require the client to decide whether to continue the entire program. What is the best response? So the client is in outpatient treatment. They don't want to participate in anger management, but they want to continue individual counseling. Okay. What's the best response? B is the best response. Explore the client's reasons for refusing the group, discuss possible treatment changes, and review whether participation is required by the program. B is correct because clients do have the right to participate in decisions about their treatment, and they may refuse recommended services. The addiction counselor should explore the client's concerns, explain possible clinical impact, and clarify any program requirements before determining what happens next. So that would be the best response, the most comprehensive response. A is incorrect because the client's right to refuse treatment is important, but refusal may have consequences if the group is a required part of a program. So you must talk to them about possible impact on their clinical treatment or whatever requirements they may have. The counselor should first clarify the requirements. The counselor must clarify concerns and explain to the client how refusing the group affects the overall treatment plan. D is incorrect because discussing possible consequences is appropriate, or the impact on their clinical treatment, but requiring the client to choose between accepting all services or leaving the program may be unnecessary, and it limits the client's autonomy and self-determination unless participation is an actual requirement. Again, you review program requirements and you discuss, because this may be something they may be able to do, maybe not, maybe it's court appointed. The knowledge you need to know for a question like this: you need to understand client rights. Clients can refuse treatment. Self-determination and treatment requirements. The skill you need to know: understanding client choice and balancing it with clinical recommendations and program requirements. So yes, the client has the right to refuse, but they also have the right to be informed of how this may impact treatment or any requirements of a program. Question 8. A client in addiction treatment understands the counselor's recommendation but chooses a different treatment goal. The counselor believes their recommendation would likely produce better outcomes, but the client's choice is informed, reasonable, and does not create an immediate safety concern. What best reflects the ethical principle of autonomy? A. Support the client's informed choice while continuing to provide clinical guidance about risk, benefits, and treatment options. B. Follow the client's preferred goal after documenting that the client declined the counselor's recommended course of treatment. C. Continue exploring the counselor's recommendation until both the client and counselor agree on the most clinically appropriate goal. Or D. Respect the client's decision but seek consultation before changing the treatment plan from the counselor's original recommendation. Which answer best reflects ethical principle of autonomy? So the client having control over their own choices, their own treatment. Okay. The correct answer is A. Support the client's informed choice while continuing to provide clinical guidance about risk, benefits, and treatment options. A is correct because autonomy means respecting the client's right to make informed decisions about their own treatment. The counselor still provides professional guidance and education, but the counselor does not override a reasonable client choice. Keyword reasonable. Nothing that would make their health and safety at risk, but a reasonable choice, even if you think it's not the best choice. So they can't, we as an addiction counselor can't say, no, you're not going to do that. We're going to take your autonomy away. No, listen to me because I would choose differently. B is incorrect because documentation of informed refusal may be appropriate, but autonomy involves more than documenting disagreement. The counselor should continue providing appropriate clinical guidance and collaborate with the client's treatment planning. C is incorrect because collaboration is important, but ethical treatment does not require the client to ultimately agree with the counselor. Requiring agreement can shift decision making away from the client. And D is incorrect because consultation can be appropriate when an ethical or clinical concern exists, but a competent client making a reasonable, informed choice does not automatically require supervisory approval. So again, the therapeutic relationship when you're providing addiction counseling is going to come with disagreements, maybe. As long as there's not a health or safety reason, there doesn't have to be agreement from the client about the choice. We're there to sit and support them with processing these choices and understanding how it might affect their recovery. So as long as they're not in danger or their health and safety is at risk to a point where they're going to be harming themselves, they don't have to agree with our recommendation. We just have to support them and continue to give them guidance, watch out for risk, watch out for how it benefits them and how it affects their treatment. What you need to know about a question like this, so when you're asked about client choice, you need to understand autonomy, their ability to make their own decisions about their treatment, self-determination, informed choice, and professional responsibility. So what is our professional responsibility when it comes to the client making their own choice? It's their choice as long as they're not in danger and their health and safety is not at risk. The skill you need as the addiction professional, you need to be able to recognize when to respect informed client decision, even when it differs from your recommendation. Question 9. During an individual counseling session, a client reports a specific and credible intent to seriously harm an identifiable person and provides details about the plan. What is the counselor's best ethical response? What's the best response? A. Maintain confidentiality while documenting the threat and increasing monitoring of the client's behavior. B. Attempt to reduce the client's anger and consult with the supervisor after the session before taking further action. C. Assess the seriousness of the threat and promptly follow laws, ethical standards, and agency procedures for protecting against harm. Or D. Immediately warn the identified person because any specific threat automatically requires direct notification by the counselor. What is the best response from a ethical and a professional responsibility lens? So your client says they have a specific and credible plan. They have an intent to harm someone. And they have identified who, what, when, where, and why. The correct answer is C. Assess the seriousness of the threat and promptly follow your laws, your ethical standards, and agency procedures for protecting against harm. So basically, you're going to take immediate action per your clinical insight skills. You're going to assess per the laws of your state and per the standards, ethical practices, and agency procedures. And usually that informing some type of law enforcement, documenting, reaching out to a supervisor. Excuse me one moment. And C is correct because the counselor should have first assessed the seriousness and the credibility of the threat and then take appropriate protective action based on the laws and procedures in your state and per your organization. Duty to protect requirements can vary by each state, so the counselor must know and follow the requirements that apply to their practice. So depending on your state, jot down your duty to warn, duty to protect laws as a licensed or certified professional. A is incorrect because documentation is important, but confidentiality may be limited when there is a credible threat of serious harm. Documentation alone does not address the safety concern, so that's not immediate enough. That's not enough. B is incorrect because de-escalation and consultation may be appropriate, but the counselor should not delay necessary proactive action. So anything where there's a specific plan to harm someone or self, your answer is going to be take action. D is incorrect because warning the potential victim may be appropriate protective action in some circumstances, but is not automatically the required response in every state. The counselor must follow all your state laws and your organization procedures. So again, be familiar with your duty to warn, duty to protect, and mandated reported laws per your state. What a question like this is asking on the exam is, do you understand duty to protect? Do you understand confidentiality exceptions? Like, when can you break confidentiality? When someone's health or safety is at risk. That's the easiest way to remember it. And it has to be a true risk, a credible risk. You need to understand risk assessment, and then you need to understand your state specific requirements. The skill you need is your ability to recognize when a serious threat requires the counselor to assess and take appropriate protective action. And this falls under ethical practice when it comes to self-harm or suicidal ideations. Question 10. An addiction counselor has been working with the client for several months. The counselor becomes frustrated with the client's repeated relapse and decides to stop scheduling appointments without discussing termination or providing referral options. Which statement best describes the counselor's actions from an ethical, legal, and moral perspective? A, the decision may be morally understandable because of the counselor's frustration, but it is appropriate if the client has repeatedly failed to follow treatment recommendations. B, the decision is primarily an ethical concern because abandonment is governed by professional standards and generally does not create potential legal consequences. C, the decision may violate ethical standards, create potential legal liabilities, and conflict with the counselor's personal values regarding responsible care. Or D, the decision becomes a legal concern only if the client experiences documented harm after the counselor stops providing treatment. So the counselor has been working with a client. The counselor is frustrated because the client continues to relapse. And so the counselor stops scheduling the appointments without discussing this with the client. Which one of these best describes the counselor's actions from an ethical, legal, and moral perspective? Okay. There should be a telltale sign in this question. Something should jump out to you. The correct answer is C. The decision may violate ethical standards, create potentially legal liability, and conflict with the counselor's personal values regarding responsible care. The thing that should have jumped out to you is that the counselor becomes frustrated with the client's repeated relapse and decides to stop scheduling. So there is a feeling connected to the counselor, and the counselor makes an action based on their own feelings. We can't make emotional decisions about a client's treatment. That's why we have to either stay in therapy ourselves, be in consistent clinical supervision, or taking care of ourselves. Because it's okay to be frustrated, but you can't make a decision based on your own personal frustration, if that makes sense. Because now you're being, that's unethical. Secondly, repeated relapse might be a part of the process. Again, that's why we're a specialty. We're a counseling specialty. This should be expected. Some of our clients will struggle and will relapse, and it should be seen as part of recovery, possible relapse. Okay. So to explain C is correct because that one action is an ethical issue, a legal issue, and a moral issue. You can't just end services because you're frustrated with the client. Depending on the circumstances and the state, it may also create potential legal liability. You can't just say, okay, I'm not going to work with you. You keep relapsing, you're not listening, you're not following anything we're working on. And you just can't do that. Now, you can be frustrated. You need to talk to, again, your supervisor or your therapist and work through some of this frustration that might be coming up. But you can't act on it. It would be unethical. The counselor may additionally view the decision through their own personal morals. So you may personally think that relapse is failure. You may want more. Your definition of relapse may be different from the client. So again, this is stuff we have to work through as professionals. We're still human, but we can't let our feelings and our human error and our emotions affect treatment. A is incorrect because a counselor's frustration may be personally understandable, but personal feelings do not remove professional responsibilities. B is incorrect because abandonment is an ethical concern. We have to do our due diligence to end our therapeutic relationship, discharge, or connect the client to other services. It's not wrong to feel like you're not a good fit. It's not wrong to feel like another provider would be a better fit. It would be unethical to just say, I'm done. I'm having a hard time. I'm just not going to schedule that client anymore. We can't do that. And D is incorrect because actual harm may be important when determining legal liability, but the counselor should not wait for harm to occur before following appropriate termination and transition procedures. So for a question like this, they're testing your knowledge of ethical, legal, and moral implications. So our decisions can be all three. So one decision you make could hit an ethical, legal, and moral issue. The skill you need to be able to recognize your professional responsibility when you're making decisions. And just, sit with a colleague, a supervisor, consult. Hey, this client might not be a good fit. And you work through it. Is this a personal thing? Is this just clearly you just think you're not a good fit for the client, and you work through it, and then you make a ethical and professional decision instead of just focusing on the emotion of frustration. Okay, so key takeaways for tonight. So hour 1, lean more to professional standards and responsibilities. Hour 2 was ethical decision making, and hour 3 was more legal topics sprinkled in. We dedicated a whole intensive session to professional responsibilities and ethical standards as addiction counselors and addiction professionals. So as we wrap up, I want you to see how these 3 connect, because on the addiction counselor exams, sometimes they are tested together, or the question requires you to think critically. It may be a question on a totally different topic, but they weave in ethical issues and professional standards to see if you're going to pick the safest and most ethical answer. Professional standards and responsibilities tell us what is expected of us as addiction counselor. This includes knowing our scope of practice, maintaining competence, and protecting our clients and their rights. Ethical decision making is how we work through these different situations when the answer is not immediate. We identified the issue, we reviewed our code of conducts, we considered the client's rights, their health and safety, and we make sure we seek supervision when we need support making ethical decisions. Then we have the specific laws and regulations that we work under. They tell us what we are legally required to do. This includes confidentiality requirements, HIPAA 42 CFR, mandatory reporting, duty to protect, informed consent, and other laws and legal, federal, and state requirements that you should look up, depending on the state you're in, to make sure you're within limits. For the exam, pay attention to what types of problems you are being given. Read your questions carefully. Ask yourself, what is the legal, ethical, or moral dilemma, or how do I make the best answer that keeps my client safe? And remember, personal morals are not the same as professional ethics. What you personally believe should not determine what you professionally do. We work under a standard, hence why we are studying together to become licensed and certified, because we want to show people we understand the standards that we're working under. So the connection between all three topics: know your role, know your responsibilities, know the rules, and know how to make a sound, professional, safe, clinical, ethical decision when the answer is not obvious. All right, guys. Went over a little bit, but we have finished the third hour of our fourth intensive session. I would like to thank you for joining me over the last month. I truly enjoyed you guys with these intensive sessions. Again, if you're still with us, thank you so much. I appreciate you for supporting this learning community. If you haven't already liked the video, please give the video a like. If you're not subscribed, you might as well go ahead and subscribe. We study partners now. We're going to be studying forever. We're lifelong learners, y'all. Again, thank you so much. The next video will be in 2 weeks, you guys. I have some work obligations, so I won't be posting live for 2 weeks. I'm going to make sure I post in the community post area, where I'll post all of the playlists. So you don't think y'all going to get out of studying, especially if you have an exam coming up in the next 60 days. I'm going to post all the playlists. Thank you to the playback. If you made it this far, I appreciate you. And hopefully everyone be safe. Good night. And congratulations again to Akila. Akila passed her exam, y'all. She's a certified counselor now. And she's studying for the NCE too. Thank you again to Jamie and Doreen for your contribution to the channel and my jerk wings, as Jamie said. All right, guys. Thank you. I appreciate you guys. Be well and take care. I'll see you in a couple weeks. Good night.